Hi, I'm Marissa. For my interview, I chose to interview a nurse practitioner who works at a medical clinic for the city of Loveland. And this medical clinic provides services for all the city employees and anyone who is on their health insurance, and they provide it for free for all those people. Um, the medical clinic provides a lot of different services, and they provide anywhere from preventative care, well woman visits, sports physicals, vaccines, primary care, acute care. She said they can take care of lacerations there in the little clinic, the office. They take care of people with colds and infections, some urgent care, and family practice type. So she's able to cover a lot. The clinic is also able to prescribe and hand out medications there, depending on the medication. Otherwise, she can prescribe anything, and I can pick it up at a pharmacy, or anyone can. So this clinic is very small. There are only 2 employees, the nurse practitioner, and then there's a medical assistant. So the nurse practitioner, besides being the provider and seeing patients, she also manages the clinic. She manages labs, manages inventory, and she also supervises the medical assistant. So this clinic provides services for anyone from 2 years old all the way up to, she said they have people who are 70 years old. It just depends on if you're on the city insurance, then you can go there. So some of the benefits of the City of Loveland Medical Clinic include that it's a free health service for its employees and anyone on their insurance. I use it because my husband works for the city, and I use it kind of as my primary care. So what I like about it is the nurse practitioner actually knows me. She knows my medical history, and I feel like she knows me better than any provider has ever known me in previous situations. So I really like that I always am going to get the same person, and she knows who I am and what's going on. The clinic is really great at promoting wellness for its patients and the city employees. They have some really fun incentive wellness programs and competitions that people can sign up for, and they can win prizes and work together with teams to hopefully better their wellness or reach a goal that they've set. Some of the prizes that she said that they offer include we get discounts on insurance if you do certain things, like wellness checks throughout the year. You get gift cards. She said that they do giveaways like Fitbits and Nike shoes, healthy cooking programs, and they also do passes to the local rec center. So it kind of helps people work together or just set their own goals and work towards something, and then kind of have a fun prize at the end. She said that she likes to help people work on their chronic issues and just work towards better wellness. She's also able, since it's such a small clinic, she's also able to refer them to specialists if they need more health care than what the small walk-in clinic can provide. So that's nice that you can go there and she can direct you towards anyone that you need to be. So the biggest issue that she had when I was speaking with her is that she feels like there's a lack of support. And when she says this, she means because there are literally only 2 of them who work in the clinic, and it's always the same 2. So if someone is sick or they want to go on vacation, it makes it really challenging. Because if one person's sick, then the other person has to run the clinic completely by themselves. And if that's the nurse practitioner who's sick, the medical assistant can't do everything that she possibly has appointments for that day. So if she wants time off, there's generally no one to cover them. So they have to plan months in advance for vacations to hopefully get coverage, and that doesn't always work. Another challenge she faces is she really wants to help people work on becoming healthier in their lives, and that can be difficult because obviously it takes both the patient and it takes her sometimes to make those goals and solve some issues and help work towards making changes for a healthier life, and that can be challenging. She helps people manage their blood sugar, weight, and she helps them with a wide variety. She also said that because she has kind of a lack of support, there's not really anyone else that she can go to. She has other trusted healthcare providers that she knows personally that she can call and get some help with if she needs to. And this clinic is, though it's through the city of Loveland, it is managed by a company called Marathon Health, which is headquartered in Vermont, and they just have a contract with the city to provide these services. So it's not like the city of Loveland runs it, it's ran by this Marathon Health. So she partners with a lot of different people, since she is able to kind of direct people to where they need to go, or patients where they need to go. So she partners with the local Larimer County Health Department. She partners with therapists. She writes referrals to different specialists and consults, and she is able to send patients to local healthcare facilities or primary care providers if they need to be. And she would also send them to UC Health and Banner for things like imaging, if they need x-rays or that. The provider talked about some things that she really enjoys, like the wellness and preventative aspect of the care. She likes health promotion, helping patients create goals for their health, guidance for their health. She likes the primary care side of the clinic. And she has done a lot over her career, so she's able to bring a lot of those different experiences to this little clinic to help a lot of people. She has done rural healthcare, worked in the city, a large family practice, worked in geriatric, in psych, rehab. So she's kind of done a little bit of everything. So I feel like when I go to her, she is able to handle anything I might have, any questions, concerns. The article that I researched is called The Value of Worker Well-Being, and I chose this one just because there weren't a lot of problems that the provider that I spoke with had besides the support, but I felt like really focusing on how employers can help their employees be healthier in their lives is really important, and it's a great benefit to have for those employees and their families. So this article talked about the average U.S. worker spends about half their life working or in work-related activities, which is kind of crazy. And obviously this can affect our health. Some people are happy in their jobs and love them, and other people might work way too many hours or stressed or just can't find a balance with home and family. And I definitely feel that way in nursing school and trying to find a balance. So I really think it's awesome when employers can provide stuff that could possibly help reduce stress or help someone find a healthier way to live. So this article discusses how employers can help their employees improve their wellness and happiness. It says people in good physical and mental and emotional health do better in the workplace, which is obvious, and I feel like especially for nurses, if we are mentally happy and healthy and physically healthy, especially for a lot of the things we have to do, it makes our job so much better. So things employers can do to improve well-being include paid leave, higher wages, greater I'm gonna skip that one. Flexibility, control over tasks, improvement to the work environment, and access to healthcare. So on the federal level, the National Institute of Occupational Safety and Health at the CDC supports workers' well-being, and in the private sector, the National Business Group on Health helps companies optimize business performance through health improvement, healthcare management, and has resources on implementing employee health and well-being programs. So this article just kind of talked about some of the federal and then on the private sector what can help these companies and businesses create well-being programs. So the article at the end stated that it is important that these employers continue to work towards implementing more employee well-being programs, because while they've started to, there's still a long ways that they can go. But I just felt that this is a great benefit to have, and it makes it easy to take care of our health. I can message her anytime I have a question, and she's right there to help me. So I feel like this is a great way for people to take control of their lives. Thanks.